So let's talk a little bit about the aging face. We all get older. We want to prevent or delay that as much as possible, but it is inevitable. And the amount and how we age depends on various things. Genetics is, of course, very important to how you age, but you can't choose who your parents are. Other things that you can do, so sunscreen and sun protection, avoiding tanning salons, avoiding sunburns, that's really critical to minimizing and preventing the aging process. So are things that dehydrate your skin. So, for example, drinking too much caffeine, drinking too much alcohol, it dehydrates your skin. It makes it look more sallow, more wrinkled. Same with smoking. Smoking has numerous adverse effects, including cancers of various sorts and heart disease, but it's actually quite awful for your skin too, as far as the discoloration of the skin, the fine lines and deep lines that form as a result of smoking. As far as what can we do for patients that want to minimize the aging process, so first off, as mentioned, I think sun protection is critical. Secondly, I think a good home regimen is important. So using mild cleansers rather than soaps, using a good quality moisturizer as recommended by your dermatologist. I would also say using anti-aging products, so creams and gels and serums, things that contain, most importantly, things like retinoic acid or retinol or tretinoin. Things that contain vitamin C in high concentrations, things that might contain glycolic acid or peptides or stem cells. So there's a number of products out there with the right ingredients that can make a difference. There's also things that your physician can do for you, for example, your dermatologist. And for example, we talk about the upper face, and the upper face is prone to wrinkles due to movement, what we call dynamic wrinkles. And so we develop forehead creases or horizontal lines over time from raising our brows up and down. Similarly, we develop the frown lines between our eyes, and we develop crow's feet that radiate from our eyes on the side. Those dynamic wrinkles respond incredibly well to botulinum toxin, of which there are various versions. Botox is the original with 20 years of experience, but there are newer products, for example, Dysport and Xeomin, that treat similarly. These products are very safe, very effective, used widely around the world, and Botox, as mentioned, has over 20 years of experience in various indications. For the lower face, we start seeing sagging. We start seeing volume loss or depletion. And so the face starts to descend, and we start to get more jowly as well. And we develop deep lines between our nose and our mouth, what we call nasolabial folds or laugh lines. We also develop volume loss here, which we call marionette lines, which go from the corner of the mouth to the chin. For these areas of volume loss, or for example flat cheeks, we use dermal fillers or injectable fillers, and those would be things like hyaluronic acids. And hyaluronic acid is a normal substance that's in your skin. Unfortunately, as you get older, it gets depleted, and we can actually inject back into the skin the same hyaluronic acid that was always there. And that would be products like Restylane, Perlane, Juvederm, Teosyol, for example. There's also other products like calcium hydroxylapatite, which is Radiesse, and even products like Sculptra as well. And these all work in slightly different ways to plump up the skin, to fill out those deeper lines that we develop in these locations, to plump up the cheekbones, or even to treat the tear trough, the groove that some people develop under their eyes. The fillers can also be used to plump up the chin. As we get older, we develop osteoporosis or bone thinning, and that includes the face bones. And so the chin starts to recede as we get older, and we can plump up the chin so that it's more balanced with the nose. Otherwise, the nose starts to look bigger as we get older because of the bone receding in our mandible and maxilla. So I've talked about Botox for the upper face. I've talked about the fillers more sort of for the lower face to plump up the skin. I've talked about some of the products and creams and serums that you can use. The final thing would be treatments that deal with pigmentation, brown spots that we develop on our face, things like melasma or lentigos or sun freckles that we develop with sun damage typically, as well as color changes that occur with the skin, a dullness that develops with our skin, fine lines and crepiness. And for that, you might think about treatments like chemical peels and microdermabrasion, and more specifically and a little more aggressively but very effective would be some of the lasers. And so we have photorejuvenation lasers, and we have fractionated lasers that can resurface the skin. So we have lasers that can deal with the redness, burst blood vessels that some people get, and the brown spots. We also have lasers that can reduce acne scarring or chickenpox scarring, for example, the fractionated lasers. So really dealing with the aging face as far as prevention, as far as treatment, you're best off to see your dermatologist to determine what's sort of the best combination treatment for you, because it's rarely one thing that's needed. It's often what we call a multimodality approach, where we treat pigmentation and surface changes, we treat deep volume loss, and we treat dynamic wrinkles.